like you just to tell us what do you intend to do with the 4 key items which have been highlighted. One of them is the effects of COVID, because we are not immune from that, even as we plan these big things to do. There's the aspect of the climate change, which is really not in your docket as such. And thirdly, we have the war in Ukraine, as you know, it is a factor. Lastly, all these things are leading to what we call economic crisis, because politically speaking or economically speaking, there are some things which we also need to acknowledge that they are somehow beyond ourselves. So maybe if you can touch on those, because so that they don't affect the good plans that you have. Thank you.
Thank you. That's a real welcome question. Let me start. I'm going to focus, like I said, on community health workers. The city is very densely populated. It's 696 square kilometers. We're 6 million of us. We need a front army that drives preventive medicine, preventive health care, rather than curative, deworming, all those things. And that's why I'm promising that once I have fixed the revenue challenge, the community health volunteer will become community health worker. I don't know whether you know, under NMS, one of the things I celebrate them for, although we see the pedestrianization and the cleaning of CBD, is the digging of 193 boreholes in the Nairobi metropolitan area. 145 of those boreholes were done in the informal settlements. That is what rescued Nairobi from COVID-19, because those people did not have water. You remember in the past, people used to campaign based on how many trucks they deliver of water to the informal settlements. If you go to the informal settlements now, 2 things were done: access roads and low-income areas, and the boreholes. Unfortunately, government somehow doesn't know very well how to promote itself. But me, I know, because I go to those places. But government did a sterling job. We would have all died here. You know the way Bill Gates' wife was saying? But she did not know that we had a beautiful, those boreholes, they are drilled and they have high water tanks. Those people are accessing clean water today. So COVID-19 is an issue of clean water. I've also talked about the way leaves that we are going to do, and also prevent the food system in Nairobi and the food handling in Nairobi. We are going to look at it. So, and also recycling of water, solar heating, basically regreening our energy space, and also providing a lot of, I want to bring the third utility to life in Nairobi. The third utility is data. Water and sewer has always been a city utility. Electricity has always been a city utility. Data is going to be a utility in Nairobi. I don't know whether you know that Kenya Pipeline Company has a dark fiber. It connects straight to Seacom and Teams in Mombasa. We are going to partner with the Kenya Pipeline Company to fire up and light up their dark fiber. Public spaces, hospitals, schools, offices. This will be a city where data comes to you at a level and a bandwidth you can't imagine. That's why in the city you should not get a leader with a narrow bandwidth. This city requires somebody with a wide bandwidth, a broadband bandwidth. We will give that data service, and that data service allows you to access and do what you can do, and only we know how to do that. I was sales and marketing manager of Africa Online. I was the first guy to sell high-speed data in this city in the early 2000s. I understand that game. And at the same time, on global, you've raised an issue about Ukraine. After the Ukraine crisis, it has brought to the fore. It has created a crisis in foreign exchange, inflation, because wheat, edible oil, maize, steel has come to. There's a challenge with that. You know, we should actually, even COVID-19, making vaccines became, and even building masks became an issue. I'm a real believer that it is time for leaders like myself in office to insist that we should consume what we produce. In fact, I'm not going to use that cliche called buy Kenya, buy Kenya. It bores me. We should consume what we produce. That has been the biggest problem of the African and the biggest problem of the Kenyan. In fact, if you're not largely rural Kenya, when it comes to food, for instance, consumes what it produces, because everybody has a kitchen garden. That's why they are very healthy, they are not stunted. But if you look at Nairobi,